Tom Yan loves the great outdoors.
I ride in the summer, I play tennis, I hike, I kayak and canoe.
But for the past 10 years, he spent a lot of time in the confines of his car, driving 2 hours from his home in Vermont to the Jocelyn Beth Israel Deaconess Foot Center at Beth Israel Deaconess Medical Center in Boston.
It's always worth the trip. I never think about going to a local doctor when I have feet problems. I just get in my car and come down here.
Tom has type 1 diabetes, which puts him at higher risk for neuropathy or nerve damage in his feet. Often, he can't feel sensations like pain, cold, or heat.
I've had ski boot heaters get away from me and burn holes in the bottom of my feet.
Because diabetes also causes poor blood circulation, foot injuries left untreated can become infected more easily.
If a patient ignores it and a sore isn't healing, they can lose a toe, or more drastically, they can lose part of their foot or their entire leg.
Tom learned that the hard way. He had to have part of his toe amputated when an infection got out of control. Now he takes a good look at his feet every day, and if there's a problem, he heads straight to his podiatrist at BIDMC, Dr. Barry Rosenblum.
Feel that vibrating there?
I'm always able to be seen on the very day that I make discoveries about foot issues. I usually get in my car in Vermont and make my appointment on the way down here.
We've got patients that come from as far south as Virginia, Florida. We've had patients come from Europe and the Middle East.
Whether they travel from near or far, people with foot problems come to BIDMC in part because of the podiatry department's national reputation as a leader in diabetic foot care. The hospital's partnership with the Jocelyn Diabetes Center and its exceptional team approach to treating feet result in state-of-the-art wound care and a lower rate of amputations.
We work with, in a collaboration with other specialists such as infectious disease, endocrinology, all being part of the team in trying to allow patients to save their limbs and avoid amputation.
It is not unusual for me to pick up the phone, call one of the vascular doctors and say, I have a patient who's here from Virginia, let's say. I think they have a circulation problem. Can you see them? And they'll see them that same day.
And their expertise goes well beyond diabetic foot care.
We treat every other aspect of foot conditions, from simple, everyday bunionectomies and hammer toes and neuromas and heel spur plantar fasciitis to the traumatic injuries.
That looks great.
Dana McDonald had a big scare last year when he dropped a chainsaw on his foot while working at an excavation job on Cape Cod.
I ended up severing the tendon in my big toe.
Local emergency crews knew they didn't have the experience to treat such a serious injury and med-flighted the 23-year-old to BIDMC, where he's been coming for treatment ever since.
It takes, depending on traffic, anywhere from an hour and a half to 2 hours, but it was worth the checkup.
You're back to golfing? Yep.
Everyone takes care of you like you're the only patient in the hospital, and it was very comforting.
These patients develop a certain comfort level, and once they establish that relationship and that comfort level, they are more than happy, more than willing to travel that extra distance to maintain that relationship and see their care through.
After 10 years, I have personal relationships with many of the people here. So they're already down the road with me by the time I get here. They have a history with me, and that just makes me feel very confident that this is the place to be.
Thank you.